Hello everybody, this is Kumar Mohit. I'm a student of medicine here at University of Perpetual Health System Delta, Jonelta Foundation School of Medicine. So today I'm going to demonstrate you how to examine the lung and thorax. So here we go. This is my patient for today's demonstration. So will you please tell me your name and your age?
My name is Kumar. My age is 22.
Okay, so we have male patient of 22 years old. Now we are going to demonstrate you. First of all, before the examine the thorax and the lung, we have to know about the anatomy of body. So we have to know here is the trachea, and we have to also see the position of trachea. It should not displace from their original position. And here this notch is above the sternum. Here this is the sternum, and this is the manubrium. Above the manubrium we have this notch, sternal notch, supraesternal notch. Okay, so now lateral to this notch we have this bone. This is the clavicular bone. We have to also know the three imaginary lines, which are the first one is the middle line, this one is known as the mid-sternal line, and here to the middle of the this clavicle, this is known as the middle clavicular line, and here is the one more imaginary line. This is the anterior axillary line. Will you please raise your hand? Okay, and the inside this we have the middle of the axile, the line which passes the middle of the axile. This is known the mid axillary line, and posterior to this one is the posterior axillary line. Okay, now one more that we know that our lung is extended up to from here. This is the clavicular bone, and 2 to 3 centimeter of our lung apex is here above the clavicular bone. Okay, we have to palpate and auscultate it as well. And lower border of the lungs we will see here about, I think, at the mid clavicular line, about 6th rib. On the 6th rib we have this lower border of the anterior border of the lungs. And now if you are going to palpate the ribs, then we have to come down from here, and then about 5 centimeter down this supraesternal notch we have to come here, and this is the sternal angle, and we have to go laterally from the sternal angle, and somewhere over here we have the second rib of this patient. So this is the second rib. Now we have to go down in the spaces, and like that we have to count that how many ribs are there. All right, means how many ribs we can palpate. Okay, so we have to also know that anteriorly we can just palpate about 7 ribs, because 7 ribs are connected here at the manubrium anteriorly. We will go little laterally, then we will able to palpate the up to the 10th rib, means the 7, 8, 9, 10 as well. And for the posterior side we have to palpate the 11 and 12 rib, because they are the floating ribs. All right, so these are the some anatomies. We have the posterior lining as well, the imaginary lining in the posterior side, which one, a line which is passes through the posterior through the scapula, mid of the scapula, that is known as the mid scapulary line, and the line which is passes through the middle of the body on the vertebra, so this is known the vertebral line. So that was all the anatomy. We have to also check the color of the nails, lips and the eyes, because there may be some signs of the cyanosis, so we have to go for that. Will you please show me your nails? Alright, so we have to check the nail side color. Remove your glasses. Okay, eye color, lips. Okay, so we have checked that cyanosis, that there should be not any bluish color on the skin. So that was for that. We have to also inspect the chest while from the distance, like that. We have to observe the respiratory rate. For the normal people, we have range of respiratory rate is about 14 to 20 times in a minute. So we have to just observe that as well. We have to also observe the symmetry of the chest. Is there any visual deformity on the chest or not? So we have to observe that all factors, and later on we will palpate the everything for the anterior examination. So just now we are going first for the posterior examination. Just we have recorded the respiratory rate. It was about, I think, almost 16 per minute. So that was fine. Now we are going for the posterior examination first, and then we will go for the anterior examination. We are going for our first examination, posterior thorax examination. So before that, we have to know that we have to follow the all four steps. Like first one is to inspect it properly, we have to observe it properly, and then we will go for the palpation, the structure, and then we will go for the percussion, and then for the auscultation. Auscultation is very important, we will do it at the last. So first of all, we have to observe it, and this is our first step, to observe it properly, the symmetry of the back or the posterior thorax. And we have to also just see, is there any visual deformities, is there any kind of any shape and size change in the back of the patient. So we have to observe it properly. This was the first step. For the second step, we have to palpate it properly. We have to find out if there any tenderness, is there any lumps or any deformities. So we have to palpate it properly with our hand. Okay. Not only posteriorly, we have to also palpate it properly from the lateral side. Okay, because our different lobes of the lungs, we can just observe it from the lateral side. Okay, we have palpated it properly. Now we have to go for the percussion. So before going to the percussion, we have to just do one more examination, which is for the chest expansion. We have to put this shape around the chest or the back of the thorax, and then we have to make some folds here, and then please inhale for me. Okay, again. So we have to see the symmetry between the whenever our patient is just inhale or the take breath, then the movement of the hands is going symmetrically or not, or the proper both sides should be equally going outward or not. So we have to observe that properly. And the next thing what we have to do, we have to just percuss. For that, we have to just our finger here, put our finger here, and whereas we want to percuss, and then we have to just strike with our another finger like this. This should be here, and now I'm gonna to percuss. We have to observe and hear the resonance, proper resonance sound. We have to go laterally as well. And if there any dull sound, then maybe near to that place we have some collected fluid or something. We have to notice that resonant sound properly, because if it is a dull sound, then there may be some exudate or some liquid inside the thorax. And if it is very much resonant, means the hyper resonant, then might be there is a pneumothorax, means the air inside the thorax. So that should be properly observed. So after that, so one more for the checking of the resonance properly, because our lungs are resonating, so because they are air filled. So this test is known as the tactile phlegmatitis. So for this test, we have to tell our patient that please speak 99 loudly. So will you please speak 99?
99.
And we have to just touch the ball of our hand to the patient's back, and we have to just feel the vibrations. That should be equally at the both side and symmetrical sides. Okay, say 99.
99. 99. 99. 99. 99. 99.
Okay, so we have to observe it properly as well. And now for the last step, that's the auscultation. So for that, we have to take our stethoscope and we have to auscultate the sound. Please inhale. Okay, whenever I touch your back with the stethoscope, then please inhale and exhale. So for the auscultation, at least we have to just listen for the each and every place one breath. So we have to just listen the sound very carefully, because the normal sound, normal auscultation sound is the vascular sound, and that's the normal inhalation and the exhalation sound. That might be we can just hear some different kind of the sounds in the patient which are really sick, and we are really going through some some pulmonary disease or some lung disease. So there might be the crackles in the sound. The crackles may be different type, like the fine crackles or the coarse crackles. Coarse means the longer duration crackles, and the fine crackles are the soft and little bit lower than the coarse crackles. Okay, and then VG sound, like some people who have the pneumonia or the asthma, we can just see some VG sound, the whistling sound. So we have to observe these sounds, auscultate it properly. While just examining the posterior side, we have to just find out the 12th rib from the lower side at the end of the diaphragm. Okay, and then go above. Okay, we have to also look at the position of the diaphragm before the inhalation and after the exhalation. Okay, so will you please breathe in and hold it. Okay, it's somewhere over here. Will you please breathe out and hold it for some time? Okay, it's here. So it's almost this much. So for the normal person, this distance should be about 3 to 5 centimeter. We have to also notice there are the 2 points, which are the bronchophony or the egophony. So the bronchophony is the louder sound if you are getting a very loud sound from the stethoscope, and so that is known as the bronchophony. But for the egophony, we have to tell our patient to please say E, letter E. Okay, so let's go, and please say E.
E, 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 E.
Okay, so that was the perfect. We were getting a muffled sound for the E, but if we are getting change in the sound, like E is not just sounds like E, it sounds like A, then it would be a consolidation inside the lungs, and it is known as the egophony. Okay, so that was very important, and that all for the posterior examination. And now we are going for the anterior examination. So for that, we have to make sure that at the posterior examination our patient should be in the sitting position, but for the anterior examination our patient should be laid down on the bed. Okay, so for that, let's go for the anterior examination. So now we are going to demonstrate the anterior thorax examination or the lung examination. So for that, we have to make sure that our patient is laid down on the bed. So we will just examine like this, and before doing that, we have to inspect the patient's chest properly. That is there any deformity or is there any asymmetry in the chest? So we have to observe it properly from the close view. And okay, we have observed it. Now we have to go for the palpation, which is our second step for the examination. So we have to palpate it, and make sure we have to also palpate from the upper side, the apex of the lungs, and then we have to go to the down on the mid axillary line. Palpate it properly, because maybe some deformities we can figure out here. Okay, we have done with the palpation. Now we are going to do that the lung expansion test. So for that we have to do the same. We have to tightly hold the chest and then will you please inhale, deep breathe, deep breathe. Okay, one more. Okay. We have to here also observe the same as we have done in our posterior part, like we have to just observe the symmetry, the pattern while they are taking the breath, the movement of the chest as well. So we have to just observe it properly. Okay, now the third step is for we have to just find out is there any consolidation inside the lungs or not. So the third step is the percussion. So for the percussion we have again we have to put this finger here and we have to just observe the sound. We have to observe if there any dull sound. So if there is any dull sound, dull resonance, then for sure we have consolidation there. We can feel a dull sound at the left side here, over here, because of the heart. Okay, we have done with the percussion as well, and now we have to go for the auscultation. Okay, so for the auscultation we need the stethoscope and we have to just listen it very carefully. Observe the sound properly. At least listen a complete breath, laterally as well. Okay, and we have to also compare the sound from the symmetrical position, and is there any difference in the sound, and if we noticed any difference in the sound, then we have to just focus on that point properly. Okay, so that was for the auscultation and that was very important part. Now we are going to do the tactile fragmentus. For that we have to tell our patient to please repeatedly count say 99 99 and we have to observe the resonance and the vibrations from our handball. Okay, so please say 99
99 99 99 99 99 99.
Okay, so that was the part of our test. At the time of the auscultation we have to also observe again for the fine crackles or the coarse crackles. If there is any coarse crackle, then we have to know that there might be a pneumonia or the pulmonary edema. But if there are any fine crackles, then we have to go through the pulmonary fibrosis may be there. Okay, so we have to observe that. With that, we have to also find out the different kind of the VJs might be in the asthmatic patient or the bronchi. So there might be, if there any any difficulty or any blockage in the pulmonary tract or on the tracheal tree, so there might be we can see this kind of the sounds. Okay, I have examined a patient of 22 years old male and I have find out that there was no any deformities on the chest, no visual sound, no crackle sounds. I have ausculted and that patient was perfectly fine and there was nothing to mention in this examination which was I didn't get any deformities or anything. So that was the proper examination of the lungs and the thorax. So thank you so much